Hi, my name is Tracy Morrow, and I'm a student with Western Governors University, and I'll be giving a presentation for LUT1 Language and Communications. And this is on a very innovative program called Team Steps, which is TEAM, capital STEPPS, if you want to look it up online. One major goal of most healthcare institutions is the plan to improve patient safety and outcomes through the reduction of medical errors and adverse events. The Joint Commission's 2001 Critical Access Hospital National Patient Safety Goals also underscore the importance of promoting teamwork behaviors and improving staff communication in order to prevent errors. Patient care requires the collaboration of healthcare professionals from multiple disciplines. Therefore, this multidisciplinary team must communicate and work together effectively to improve the outcomes for the patient. Ramon Lavandero, RN, MA, MSN, FAAN, Clinical Associate Professor at Yale University School of Nursing, states, true collaboration, which means a work culture where joint communication and decision-making amongst all members of the healthcare team becomes the norm. Team strategies and tools to enhance performance and patient safety, or Team Steps, is an innovative program being implemented in hospitals and healthcare settings that address these issues. Research suggests that implementing the Team Steps program in healthcare settings improves patient safety and outcomes through improved leadership, situation monitoring, and effective communication among members of the multidisciplinary team. Research also suggests, as the first main point, that implementing the Team Steps program in healthcare settings improves patient safety and outcomes through improved leadership. Team leadership is the ability to direct and coordinate the activities of other team members, assign tasks, motivate team members, plan and organize activities, and assess team performance. This is accomplished through utilizing tools such as multidisciplinary team briefs, huddles, and debriefs, which are facilitated by the leader but can be requested by any member of the team. Team briefs are mainly used for planning, while huddles are used to update the team, express concerns, and for problem solving. And lastly, debriefs are conducted to review an event or shift for the purpose of process improvement. And this poster behind me is an example, and I'll go over it shortly. But it's one of the tools that was developed at Bentab General Hospital in Houston, Texas, and they use something similar to this. And this is a shift snapshot. It's a tool that can be used to conduct these team huddles, and we'll go over that shortly. The second main point is research suggests that implementing the Team Steps program in healthcare settings improves patient safety and outcomes through situation monitoring. Situation monitoring is the process of constantly scanning and assessing a situation to gain knowledge of what is going on around us. However, situation awareness is knowing what's going on around us. Team Steps increases team awareness through a shared mental model that results when all team members maintain situation awareness or are on the same page. And this tool that reviews the L&D shift snapshot is really very instrumental in helping all the team to know what is going on around on all the units that encompass our L&D department. And last, our third main point is research suggests that implementing the Team Steps program in healthcare settings improves patient safety and outcomes through effective communication and among members of the multidisciplinary team. Several tools are utilized in the Team Steps program to improve communication, such as SBAR, call-out, check-back, and handoff reports. The situational briefing model, SBAR, which stands for Situation, Background, Assessment, and Recommendation, has improved communication during patient handoff reports. Call-out and checkbacks have improved team communication by communicating important information to the team simultaneously during emergency situations and verbally confirming instructions or orders received from the physician, thereby closing the loop. In conclusion, research suggests that implementing the Team STEPS program in healthcare settings improves patient safety and outcomes through improved leadership, situation monitoring, and effective communication among all members of the interdisciplinary team. In closing, I'd like to point out that research has found that 70% of all medical errors can be attributed to breakdowns in the healthcare team interactions. Evidence shows that team training improves communication and decreases the incidence of errors by multidisciplinary team members. And by providing tools and strategies to assemble 3 of the main teamwork competencies of leadership, situation monitoring, and communication, Team STEP's goal is to increase team awareness through a shared mental model. Research on team training outcomes in labor and delivery units demonstrated significant reductions in the occurrence and severity of reduction in the occurrence and severity of adverse events. At Bentob General Hospital in Houston, Texas, the Baylor College of Medicine obstetrics faculty physician on duty conducts a multidisciplinary department-wide snapshot daily at 8 a.m. and 8 p.m. as part of their Team STEPS program. This scripted report gives the staff an overview report. Updates are added and concerns are discussed amongst the team. The department-wide snapshot encourages nurses to be actively involved in the multidisciplinary team and make valuable evidence-based contributions to patient safety. This team snapshot that I have behind me, let me see if I can bring it a little closer. At the beginning you have the introductions, so you have your OB faculty attending and all the attendings, residents, and nurse managers, charge nurses, whomever is present. We go around so that everybody knows who everybody is. We discuss low risk, red flags, which for L&D is anybody with fetal heart rate decels, prolonged labor, uncontrolled hypertension, med issues, pending consults, unstable patients, probable C-sections or surgeries, anything like that we consider a red flag, and we want to discuss those. They give a moment for concerns and questions. The L&D charge nurse gives the big picture with the number of labor inductions we have, surgeries, C-sections, patients expected in. The antepartum charge nurse will discuss the number of patients and any issues on antepartum. We have triage. We discuss what's going on with the patients in triage, number of patients waiting to be seen, if there's any staffing issues, if we're short-staffed of nurses or they are back running 2 ORs at the same time and we're short of scrub techs, anything like that. They discuss concerns and questions are asked. The OR nurse discusses anything concerning the OR. Then we have our nurse midwives. They discuss their patients, their inductions, any questions and concerns for them. We have the anesthesia resident and faculty. They discuss anything concerning the C-section surgeries, epidurals running, any problems, any high-risk cases, any questions or concerns. And then we have the neonatology department. They discuss anything going on with them, any questions or concerns. And the part that I really like is at the end. This is a scripted phrase that is said by the OB attending, and it states, if any team member sees anything unsafe or not in the best interest of our patients, we expect you to speak up. If you are unable to get a timely and effective response, call the faculty OB on duty. And then it says questions, and then anybody with last minute questions, they're addressed, and then everybody disperses to their appropriate areas. And now, do we have anyone have any questions?
I have a question.
Yes, ma'am.
Where can someone receive Team Steps training in order to implement the program at their healthcare facility?
That's a very good question. There are 8 regional training centers nationwide that offer master training courses to create a national network of master trainers. These individuals may then offer Team Steps training to frontline providers in their respective hospitals and other healthcare settings. The course is free, however, a full team of 3 individuals is needed to register, and it's limited to 1 team from each member hospital per course. And I do know, as far as in proximity to Houston, I do know that I think Tulane is one, in New Orleans is one center that does offer the course. Yes, ma'am.
Also, has Team Steps improved patient satisfaction or employee satisfaction due to the improved teamwork?
Yes, it has. As a matter of fact, evidence has shown that when the tools that enhance leadership, situation awareness, and communication are used consistently, better work environments and safer patient care results. That is according to Leonard and Frankel, 2011. Team training has also been shown to improve patient satisfaction, employee satisfaction, and reduce nursing staff turnover.
That's awesome.
Okay. Well, I'd like to thank everyone for coming, and this concludes my presentation.